So what do you need to know about pain? There's three important things that I think, and the first important thing is, if you don't get your pain treated fast, you have less likelihood of a chance of healing. And then your options also decrease. So if you have pain and you're just waiting months or years before it gets treated, you most likely then have to go to more of an invasive procedure and have less, worse results than if you just got something done right away. And a lot of people just wait because they don't have time, they don't have money, they don't want to use their insurance, they don't know who to go to. So that's a big problem. So again, the sooner you do something about it, the more options you have and the better chances. And it's no different than weeding. See a couple weeds, take them out right away and keep doing it as you go along and prevent it, instead of trying to do it later when the whole yard is full of weeds. It really doesn't make sense if you think about it. And the second part is, second most important thing in my opinion is, if something is hurting a lot, or the severity of the pain, or how long it's been there, does not necessarily dictate what type of treatment you do. There are people that have excruciating pain, and they're on the floor, they're in spasm, even after brushing their teeth. And you have to call your partner in. Anyone ever had that happen to them? I mean, I actually, I've seen that with my father. Brushing his teeth, fell right on the floor, and he's crying like a baby. And you would think that he's going to die and we have to go to the ER, but really it actually wasn't the truth. So again, the severity doesn't mean you go see a surgeon right away. Now, we'll talk about emergencies in a little bit. The other thing is, again, don't start with surgery. That's the exception, not the rule, unless you absolutely have to. Now, I have a little sheet here. There's really four aspects or four buckets that most of us fit into. Okay, there could be more, but generally speaking. The first bucket is, I'm in pain, what do I do? The second one, it hurts, but it's not serious. So it's like an everyday aching pain where an Advil, a beer, a hot shower kind of, helps us. The other one is you have a definite strain or a more serious problem, but it's not, life or death or surgically related. The other one is it's severe damage or chronic pain. So I'll be really brief, but to start from the bottom is you have to assess the situation first. If you drop a big, rock on your toe and you smashed your toe, that's an emergency. You might want to call 911 or go to the emergency room, obviously. The other end of the spectrum, though, is it's not an emergency. We know it's not an emergency. What do you do? And I think a lot of people don't do anything because they either don't know what to do or they don't know who to call. We've created in my center in Randolph for Morris County as a free service. It's called a Pain Navigation service. You're hurt and you don't know what to do. You want advice? No charge. You give us a call. You speak to one of our pain specialists. And this is really good for guys who can't leave work. They're in the middle of a job, but at that moment they're just not sure. They have a spasm, they can't get up, or they don't know to use ice or heat. So we get these phone calls all the time, and hopefully we help them and for free and prevent them from actually having to take any time off of work or do any treatments. The other thing we do is we have an express pain relief service. So if it's, again, that everyday pain, if you don't have time, or even if you don't have insurance, or you have a high deductible, we do a treatment that combines 6 therapies in one. It's $49. And basically what happens is you could walk in, there's no paperwork, there's no insurance hassles, and we're even now going to various places and work sites to where, say 6 in the morning, 5 or 10 people gather up and we treat them, so we prevent injury throughout the day, or people who have pain, we treat their pain. So we're going to the work sites now, and there's a mechanic who's a patient of mine in Sunoco, and we're talking about that for his mechanics. So it's a pretty cool thing because no one has time. They're fixing cars all day, they're on deadlines. So it's been an interesting experience. The other aspect of, if it's a more serious joint or muscle problem, such as you ever twist your ankle playing a sport, or even just walking and there's a stone and you twist it and all of a sudden you get your ankle swollen and it's blown up and it's black and blue. At that point you need to consider a more intensive type of program. And that would be either physical therapy, chiropractic, acupuncture, maybe some sort of medication or injections. And you could do that in isolation and go to one place that has one of the types of therapies that you need. And then the other aspect is, your severe damage or chronic pain. You either need surgery or you're not a candidate. And at that point, you need a more comprehensive model and an integrative care. which combines multiple services. So in our office, we have multiple services under one roof. We do have chiropractic, physical therapy, acupuncture, massage therapy, and we also have a surgeon as well as a pain management specialist and a physiatrist who does nerve testing. So those programs are oftentimes months, and we're not looking to get rid of your pain. We're looking to actually manage it so that you have better quality of life and can actually work, make a living. And a lot of those types of patients require that. This is constant. So really, if you have pain, all you have to do is call our pain navigation service if you want. It's no charge. Be ready to describe what you're feeling, how you're feeling it, when you're feeling it, what are your goals. We take care of the rest. We'll support you, we'll listen to you, and the other thing we do is we'll come up with a solution that hopefully fits your condition, your budgets, and your goals. And the goal of this service is to hopefully teach you how to self-treat yourself so you don't have to spend time or money. So, and that's it.